Hi, I'm Martin Longley. I'm a GP at Milton Abbas in mid-Dorset. I've been a GP for about 20 plus years now, so I've got a lot of experience in the NHS and seen a lot of changes. And the most recent changes are probably the most exciting that I've come to experience through my career. Mid-Dorset locality is 8 practices. Fundamentally, we've got 5 urban practices in Dorchester, which are Queen's Avenue, Prince of Wales, Poundbury Surgery, Fordington and the Atrium. The Atrium also has a branch surgery in Crossway, so it has a rural bias as well. And then we have the 3 rural practices, Milton Abbas, Cerne Abbas and Puddletown. Very recently we've had a new development, which is the ICPCS money. And this has allowed the locality to look at ways of improving patient care in 3 specific areas: in frailty, in diabetes and in respiratory disease. And we as a locality work very closely together. We're very keen on integrated care and are involving all our partners in care to try and develop a service that is bespoke to our patients. A service that delivers better care closer to home, prevents hospital admissions and improves patient outcomes. How are we doing this? Again, by using that word integrated care, we are involving hospital specialities. We're involving the intermediate care, we're involving primary care skills. We're also using all the other agencies that contribute to patient health and welfare. Public health are involved in trying to make us aware of how to prevent these diseases. We've now got a respiratory specialist nurse in place who Puddletown Surgery have hosted to act as a resource for the entire locality. We had our first specialist meeting with our named respiratory consultant where practices could bring patients with difficult problems to a multidisciplinary team meeting to discuss these management issues and try and prevent this patient firstly going into hospital and secondly getting better patient care. The diabetes group is doing exactly the same thing, and the third area is a frailty team. Dorchester are flying with this. The Dorchester practice is led by Dr. Haming Blunt from Fordington Surgery. He's got a fully integrated team around him, which includes the community rehab team, a specialist geriatrician, and all the rehab services to try and maintain these high risk, high input patients, particularly those in the nursing homes, at home in their environment and avoiding hospital admissions. The rural teams have fully integrated nurse teams and have had them for approximately 20 years, and this is now a suggestion for the 10-year forward view for the NHS to develop these teams. Again, they show their value in identifying and managing the high-risk, frail elderly patients who are likely to need services and try and avoid them ending up in hospital, where the outcomes, although curing the problem that they go in with, often lead to a lot of social and environmental impact on their care, which at current levels is proving extremely difficult to source. There are a lot of patients called stranded patients in hospital at the moment, where it's the care package that is failing to, which is not allowing them to be discharged. We're trying to prevent the admissions of those patients so the care packages they have are maintained, and that is a vitally important role for the frailty teams and for all the integrated teams in primary care. The whole ethos of ICPCS money and the care packages that are being provided as a result of this is fully integrated patient care. The value is in making sure that the individual patient needs are met. We try to meet the needs of the whole population, but we must remember the individual within that population. And these projects, although in their infancy, are already starting to recognise the patient as an individual and tailoring the care needs to that patient.